Yes, so the grant that we applied for from Hospice UK was for an LGBTQ plus facilitator to work across the 3 Cheshire hospices, so ourselves here, St Luke's Hospice in Cheshire, our sister hospices at Hospice of the Good Shepherd in Chester and East Cheshire Hospice, which is based in Macclesfield. I think there was, the reason that we set up the project across the 3 hospices, there was a recognition that as part of that patient's journey in the hospice and as part of recognising the whole person, that we really had some work to do across all the 3 hospices around our policies and our processes and our procedures. So we really felt that having a facilitator to be able to guide us and support us and provide us with education and training, that would be a fantastic opportunity to do something that's spanned the whole of Cheshire really across all the 3 areas.
Research shows that LGBTQ+ people, regardless of age, aren't accessing health and social care services. There's an overall avoidance, whether that's because there's fear of discrimination, an experience in the past of being mistreated, whatever that reason might be, that avoidance is there. And the hospices have acknowledged that actually we want to overcome that. We want to reduce the amount of barriers that are in place for LGBTQ+ people. So that's what we're working to do. We're making sure that it's a safe place for anybody who needs to use it.
So Chester Pride is working with the 3 hospices in Cheshire to support them as they develop their services to be more LGBTQ+ inclusive. We're on hand to help them with training, with insights into the community. We're effectively trying to embed the community's voice into this development process so that as they evolve as organisations, they can make sure that focus on the community, focus on the patient as an LGBTQ+ individual is central to what they're trying to do here, making sure our community is getting the effective care they need if they have to use the hospice's services.
So I hope to achieve what we set out to do, and that's reduce any barriers that LGBTQ+ people have in accessing hospice care, whether they were structurally there prior or whether they were just perceived to be there. I think the hospices that I'm working for, the intentions are fantastic, and those intentions were there prior to the role. So it's just about making sure that that's clear to the outside world, making sure that people know that this is a safe place, that this is an environment that will be able to support them in their entirety.
So for the hospices to be really taking that seriously and having that conversation with us on behalf of the community really imparts that sort of importance that the hospices are putting on there to make sure that whoever comes through their doors, whatever their sexual or gender identity, they're going to be treated with care and dignity and respect. And that's the important thing, is when you're facing that kind of situation, you should be getting equal care, equal dignity, equal respect as any other member of society.